Hi there, hope you're doing well today. My name is Dr. Joel Rosen, and I wanted to talk to you about blood sugars. So, blood sugar levels is a very important analyte that we look at on your blood tests. And if you're looking at the difference between laboratory ranges and functional ranges, to give you an idea, on a laboratory range, you're looking at 65 to about 110. And from a functional standpoint, you're looking at anywhere between 85 to 99. So what that basically means is when you do a laboratory test and you get your results back, then you're going to have something that shows you what the normal ranges are and then what the too high or too low ranges are. So one thing I always want to explain to patients is those laboratory ranges, they're really broad. So what that basically means is there's a huge up and a huge uppercase value and a huge lowercase value, and that's basically compiled from the year prior of all the people that went and took lab tests, and these were standard deviations above the norm, and those that were really high and those were really low, that's what they set as their parameters. However, from a functional standpoint, you're now being compared to not all the highs and lows, but you're compared to what's considered healthy, what's considered a healthy range. So those that are in vital health and have good energy and don't have very little chances for any type of illnesses. So okay, so 85 to 99 is the ideal range. So if let's say you have blood sugar levels of 76. So yours is 76 and you get your blood test back and the laboratory ranges says that you're within normal ranges, meaning you're in between 65 to 110. That doesn't necessarily mean you're healthy. In fact, in that case, if you're below 85, in this case you're 76, then you would be considered what's called reactive hypoglycemic. If you're reactive hypoglycemic, then basically what that means is you get lightheaded, shaky, jittery, nervous, irritable if you haven't eaten for a while because you've waited too long between meals and you start getting shaky, jittery, lightheaded. When that happens, your adrenal glands will come into the equation, and they'll consider this a stressful environment, and they'll break down the stored carbohydrates and create sugar into the bloodstream. So that's not very healthy because eventually you're going to start to have difficulty sleeping, difficulty waking up and feeling refreshed in the morning. You're not going to have energy throughout the day because you've just waited too long and now you're reactive hypoglycemic. On the other side of the spectrum, if you're above 100, from a laboratory range, let's say you're 107. From a laboratory range, 110 is considered normal or healthy, and you're going to assume that you're okay. But from a healthy point of view, it should be 85 to 99. So again, you're not in the healthy range, but you're within the laboratory range. In this instance, you are considered something called insulin resistant, which means you have too high blood sugar levels circulating in your bloodstream after a supposed 6-hour fast, and that's when they do the blood. That's why it's a fasting blood test, and you still haven't cleared enough sugar out of your bloodstream, and your cells are not listening to the messages that insulin is sending to get the sugar out of the bloodstream. So when that's the case, then again you could have energy issues, fatigue issues, but more importantly on your blood test you may see high cholesterol, high triglycerides, high LDLs, low HDLs, and this is a problem with fatty acids. So now you're at risk for heart disease, cardiovascular occurrences. So really just what I want you to do is get your blood tests and see where you are on a functional scale. So make sure you're in 85 to 99. That's a fasting one-time value. The other value you want to look at is your hemoglobin A1C. That is more of a reflection of a three-month window, or what you've been averaged out for the past 3 months, and you want to make sure that you're below 5.9. If you're above 5.9, then you're at a greater risk for cardiovascular concerns, any type of heart disease, and you got to make sure you bring that down. There's a lot of things you can do to bring that down, but this is just a video to talk to you about blood sugars and making sure that you are in an optimal range. It's estimated that about 1 in 3 people in the United States have high blood sugar levels, and if you were to add on to that the amount of people that have dysregulated dysregulation or low blood sugars as well as high blood sugars, you're probably looking at anywhere between 2 to 3, 2 out of 3, or almost even more than 2 out of 3 people having dysregulation in their blood sugar levels. So some of the small tips that you can do to make sure you regulate your blood sugars throughout the day is, number one, keep hydrated. Make sure that you're not dehydrated, because that creates a lot of electrolyte imbalances, fluid imbalances, and then sugar levels ultimately will follow that. That takes on your adrenal glands, and adrenal glands again are necessary for maintaining blood sugar levels. So the other thing you may want to do is you want to make sure that you have a meal anywhere between 2 to 4 hours after your last meal. You don't want to wait any longer than, say, 4.5 hours. Make sure you have a breakfast in the morning, and really try to stay away from refined sugars. You want to have slow, complex carbohydrates. I always tell my patients, make sure you have a nice mix of all the different macronutrients, which would mean a protein source, a carbohydrate source, and a dietary fat source. And that way you're getting a nice glycemic response. Your sugar levels are staying steady throughout the whole day, and that should give you energy and make you feel as good as you possibly can. So just want to give you a little information on blood sugars today. Hope you find that useful. Thank you.